Hey everybody, Jen Hyla here, former field biologist turned late-stage Lyme disease survivor, author, and recovery coach, talking a little bit about Lyme disease co-infections. Lyme disease rarely travels alone. Ticks can harbor multiple different bacteria, viruses, and even parasites. If Lyme disease treatments aren't providing relief, there is a pretty good chance you could be dealing with a co-infection. 30% of Lyme patients report 2 or more tick-borne infections, commonly called co-infections. Those with co-infections report more severe symptoms and longer recovery times. Each co-infection comes with its own long list of symptoms that are sometimes indistinguishable from Lyme disease. And unfortunately, many of the therapies used to treat Lyme disease are not effective against these other pathogens. Similar to Lyme disease, these co-infections can be very difficult to detect using standard blood testing methods. Actually, there's not even a test for all these known tick-borne diseases. Your best bet is to get PCR testing through a lab like DNA Connections or IGeneX. Unfortunately, most insurance companies do not cover these types of tests, forcing patients to pay hundreds of dollars out of pocket, and then searching and searching, looking for a doctor willing to treat based off of those test results. So I'll just share a few of the most common co-infections here, and please pause the video if you want to read the symptoms. I'm not going to read them because I'll sound like a prescription drug commercial. So Babesa is a very common one. It is caused by a blood parasite that is not treated by those common antibiotics and antimicrobials that are used to treat Lyme disease. Bartonella is another very common co-infection that is actually infecting the lining of your blood vessels. Spotted fever, another very common co-infection. This one actually has a specific rash that's associated with it around the ankles and wrists. Ehrlichiosis is also pretty common in Lyme patients. Anaplasmosis is also pretty common and similar to ehrlichiosis. Mycoplasma is probably one of the most common that is never talked about. It is a intracellular infection that causes walking pneumonia and tons of fatigue. Poisson virus is the scariest of the bunch in my opinion. It is a life-threatening virus that can cause your brain and brainstem to swell pretty rapidly. Because Lyme disease suppresses the immune system, it can trigger all these other infections that were previously dormant to start causing problems. 95% of Americans have been infected with some kind of HHV, CMV, or EBV, and many Lyme patients find they have these viruses reactivated.